Staying quiet won't help to bring in the changes that you want to see. Speak up. Be vocal. Make the difference you want to happen. My name is NJ and I'm currently doing the Amplify course through the Canary. We all have to produce a final project for the end of the course, and I decided to do mine on the mental health services in the UK. This video will be exploring how the mental health services are currently doing and whether there's any improvements or changes that can be made, as well as some insights from people who have been through the system themselves. I find it important to question things as it helps us to understand where we currently are and if there's any improvements or changes that we can make in order to improve the services that we currently have. I'll be exploring both the NHS and private mental health services, as I feel it's important to have a look at the two different options that are available to the public in order to get a true understanding of what the situation currently is. But first, let's have a look at the NHS. The NHS is a complex system which can sometimes make it difficult to understand, especially when working out who is responsible for what. It's made up of a wide range of different organisations with different roles, responsibilities and specialities. These organisations provide a variety of services and support to patients and carers. What do the NHS mental health services cover? Here's a list. Agoraphobia, anger, anorexia nervosa, antisocial personality disorder, binge eating disorder, bipolar disorder, body dysmorphic disorder, borderline personality disorder, bulimia, claustrophobia, clinical depression, dissociative disorders, eating disorders, fabricated or induced illness, general anxiety disorder, health anxiety, hoarding disorder, Munchausen syndrome, obsessive compulsive disorder, panic disorder, personality disorder. You thought I was finished, didn't you? Phobias, postnatal depression, postpartum psychosis, post-traumatic stress disorder, psychosis, psychotic depression, schizophrenia, seasonal affective disorder, selective mutism, skin-picking disorder, social anxiety or social phobia, stress, trichotillomania. When did the mental health services get more political backing? In 1959, more than a decade after the NHS was established, Parliament passed the Mental Health Act. In 1983, the Mental Health Act was revised and the issue of consent was introduced. Although people could still be detained under the Mental Health Act if they were at risk of harm to themselves or others, most being treated for mental health conditions at this time had voluntarily sought help. Under the new Act, entry to hospital was to be decided on medical rather than legal terms. There was also some attempt to integrate mental health care within the wider NHS. In 1961, the government declared that the Victorian asylums that rose, daunting out of the countryside, should be closed and their patients cared for in conventional hospital wards or within the community. How many patients do the NHS services see? Over 1.5 million people were in contact with mental health services at the end of October. The majority of these were in contact with adult services. 21,300 people were subject to the Mental Health Act, including 15,878 people detained in hospital at the end of October. 365,925 new referrals were received, and 1.95 million care contracts were attended during October. The publication date was the 27th of January 2022. The geographic coverage was in England. The geographic granularity covered clinical commissioning groups, councils with adult social services responsibilities, independent sector healthcare providers, mental health trusts, regions, sustainability and transformation partnerships, NHS trusts, clinical commissioning regions, and country. The date range of this data was from the 1st of November 2020 to the 30th of November 2021. What are the NHS currently doing to improve mental health services? The NHS is placing more national focus than ever before on mental health. NHS England and NHS Improvement aim to deliver a transformation in adult and older mental health services by 2023/24, building on the progress made to date towards achieving the recommendations set out in the 5-year forward view for mental health, and aiming to rebalance the provision of care and ensure that people can access the care they need closer to home. The NHS Mental Health Implementation Plan 2019/20 to 2023/24 sets out the NHS long-term plan prioritises for improving adult and older mental health care over the next 5 years supported by major new investment. Why do people choose private over NHS mental health services? You're not receiving the support you want from your GP. You want a second or third opinion and your NHS GP isn't able to provide it. You want access to support more quickly. You're looking for a specialist or more choice of treatments and providers. You want more intense support or over a longer period of time. You want access to treatment that isn't available through the NHS. So we can have a look at the research and to see what the NHS are actually saying about mental health services. But is that a true reflection of what the mental health services actually are like to go through? I decided to do a mental health questionnaire to help get some more data to see what others who have been through the services have to say about what they've gone through and what those different systems like NHS and private mental health systems have been like for them. Where in the UK do you live? How old are you? How long did it take for you to get your mental health diagnosis? Would you consider going private for your mental health treatment? What are your thoughts on private mental health treatment? What's the worst experience you've had with the NHS mental health services? What does good mental health mean to you? To those who have been unsupportive towards your mental health, what is one thing you wish you could say to them? How would you improve the NHS mental health services? You know I'm doing serious business when the iPad comes out. Out of everybody that I questioned, everyone lived in England. So that was pretty easy for me to be able to see what the England NHS mental health services are like, as that's what I currently have experience with. 2/3 of my respondents were aged 25 to 35, and 1/3 were aged 36 to 50. 2/3 of my respondents had waited less than 6 months before they received their mental health diagnosis, whereas 1/3 are still waiting on their diagnosis. 2/3 of my respondents said they would never consider going private for mental health services, whereas 1/3 already had. What are your thoughts on private mental health treatment? Good quality, but very expensive. Expensive. Faster to be seen, not necessary. What's the worst experience you've had with the NHS mental health services? Being told that a self-help guide will help me deal with my suicidal thoughts. Asking a therapist in diagnosis for 15 years but essentially being told I'm not sick enough to take these pills. Being called crazy by one GP. What does good mental health mean to you? Being able to carry out daily tasks and be able to relax without being impeded by mental health symptoms. Days when my mind is at peace. It's different in everyone. Mine is able to feel happy, not all the time, just being capable of being happy. Nothing should or will be perfect, but being able to deal with those imperfect situations is key. To those who have been unsupportive towards your mental health, what is one thing you wish you could say to them? Please be more open-minded. Just because you don't understand doesn't make it any less real. Fuck you. How would you improve the NHS mental health services in the UK? Less drug orientated. Introduce counsellors into schools and workplaces across all business sectors. I wouldn't actually know where to start. These are just a few suggestions that I've come up with, but feel free to add your own as well. Write to your local MP or clinical commissioning group. Speak to your GP. Speak to your local council. Get in touch with pals. Start a conversation on social media. Volunteer or work within the NHS and make the change from the inside. Bring up suggestions to your workplace and make it more mental health friendly. Staying quiet won't help to bring in the changes that you want to see. Speak up. Be vocal. Make the difference you want to happen. And if you don't want to get involved in any of that, well, just take a bath.